What is up, you guys? My name is Austin Marks and welcome back to my YouTube channel. So in today's video I'm going to be talking about why healthcare workers quit their job. It's probably because they don't want to deal with COVID. Wrong answer. I just want to thank all those who are staying home and all those that are on the front line. I can't show my gratitude enough. So the reasons I'm going to be sharing are the same reasons that anyone may quit their jobs. However, these play a little bit more into healthcare. So the number one is some careers in healthcare don't have a lot of room to grow or basically level up. What I mean by that is nurses can continue going to school. They can start off with getting their RN with their associate's degree, then they can get a BSN, and then they can get an MSN, or they can become a nurse practitioner. So I'm a respiratory therapist. There is no real growth for respiratory. They're just starting to come out with new things. So there's something called the APRT, which is the Advanced Practitioner Respiratory Therapist. So there's only one school that offers this. So I know some other career paths would be like a PTA. They could go to PT school. However, that's kind of changing careers, but kind of not in the same way. You're going back to school doing more things. For respiratory or PTA or maybe a radiologist technologist, they can go to school, become a PA or physician assistant, something that I have in mind. It could be just an overall growth, or maybe they quit their jobs or the place that they're working at because there isn't much growth at that position. So they may switch hospitals, may switch facilities, anything along those lines, just starting somewhere fresh, that way they can have room to grow. Maybe they want to get into management, and there's a line of people who are waiting to get into management where they currently work, so therefore if they go to somewhere new where maybe a bunch of new people just started, they have the same advantages, and if they have a good work ethic, they can get in the manager position. The second one anyone really deals with, I mean, it doesn't matter what your career is, and that is burnout. Talking about healthcare specifically, so some days there is a huge supply and demand deficiency. So basically there's a lot of patients and there's not as many clinicians to be there for the patients. So therefore we have a large workload and we have a short amount of time to do it. So we have the same amount of time if we had, say, 20 patients versus if we have 40. So therefore we're overworked some days, and it all depends where your hospital is and if they're well staffed. So I know I experienced this, however some hospitals experience this a lot more than others do. So there's a hospital a little south of us, and they are always overbooked with patients, and they're always understaffed. So therefore I know someone who works there, and most days they barely get a lunch. I mean, I'm like that sometimes, however that's almost like a daily occurrence for them. So burnout, it definitely plays a huge role, and I could see them getting burnout a lot sooner than I would. So stress also plays a huge role with burnout. So we deal with sick people all day, every day. We deal with death and dying. Sometimes the family members aren't the easiest to deal with. They don't understand what exactly is going on and why we may not be able to save one of their family members. Also, PTSD is real in the healthcare system. So if you're seeing children die every single day, and you go home to your children, you're going to love them a little bit more. You're going to hold them a little bit tighter. This is especially true right now with the whole COVID thing that's going on, like the PTSD. So I work out, and whenever I'm done, I'm a little short of breath, and it just makes me think like, what's going on? Because I know I've been exposed to it, and that I have the potential of possibly getting it. Most time healthcare workers are underappreciated. If you have a different career path, you don't know exactly what we do sometimes. So right now, healthcare workers are getting a lot of recognition. However, others are kind of ridiculing us. It just, you take the good with the bad, I guess, but we're underappreciated, and that just gets to some people. Sometimes work can get a little repetitive, so that's one thing I love about being a respiratory therapist, is every day is a little bit different for me. However, if I had to go around and be on the floors all day, every single day, I would definitely get a little bored, and I want to find a new career path. So this is why nurses or even respiratory therapists may switch up different hospitals. They may go to one that's a little bit more fast-paced, one that has a trauma center. Maybe they want a little bit more experience with ICU patients. Maybe a respiratory therapist, a nurse, or anything like that may go ahead and switch to pediatric or neonatal. Also, this goes for anyone. You need to have hobbies, habits, different things to go ahead and deal with your burnout, because if you just keep letting that get to you, you can definitely become depressed, and that is not a good thing. And the third reason that healthcare workers will go ahead and quit their job is because they just change their career path completely. So they get out of healthcare. This could be for several reasons. Maybe they want a different schedule. Maybe they want to get a better pay raise. So healthcare definitely pays very well. So if you get a job outside of healthcare that pays well and you don't have to work weekends or anything like that, that may be an opportunity for you. Because working weekends is something that healthcare workers have to do, and this can go along with burnout because that can take a toll on your body or your family. Maybe the person just wants to work different shifts. So right now I'm currently working evening nights. So maybe if I want a day job, I'd go ahead and I'd switch to a different hospital because I don't plan on leaving the healthcare field anytime soon. I know that I definitely like working 3 or 4 days out of the week and having 3 or 4 days off. That's definitely a benefit when working in healthcare. So going different career paths, this may go ahead and go along with a little room to grow. So if a respiratory therapist like myself wants to go ahead and become a physician assistant, a nurse wants to become a nurse practitioner, someone wants to go to perfusion school, maybe you want to go to med school. Just switching up your career paths, getting out of what you're doing currently is the reason that someone may quit their job. If you guys know of any other reasons why people will go ahead and quit their jobs, leave it in the comments. I know there are many more than just these three. However, I made a poll on my Instagram and these were the top 3 answers that I got. So anyway, I hope you guys enjoyed this video. Like and subscribe, and I'll see you in the next one.